Welcome back. The results of a TB prevalence survey have shown that many more people are living with tuberculosis in South Africa than previously thought. Many have not been diagnosed or treated. Globally, at least 4,000 people die from TB every day. And there are concerns that the world won't reach its deadline of eradicating TB by 2030. Now, digital chest X-ray technology could help in identifying and improving efforts to eradicate the disease. Professor Deliwe Rene Phetlhu, manager of the TB program at TB HIV Care, joins me now to discuss this. A very good morning to you, Professor, and thank you so much for your time. So we are dealing with COVID-19. It is the main focus. It is a pandemic that we're trying to ensure that disappears from not only this country but the world. But then there's also TB, which in South Africa is one of the biggest killers. How best are we dealing with that?
Good morning, Morena. And thank you for the opportunity to come and talk about TB, especially on this day of TB, International Day of TB. So we are quite aware that despite the fact that COVID has been a focus, TB is killing actually more people than COVID. We're having an estimation of about 170 people dying per day on TB right now. So digital chest X-ray has come on based on a whole lot of research, which has shown that about 57% of people who have been diagnosed with TB in the previous prevalence survey of South Africa were actually asymptomatic. They did not have any symptoms. So it's somebody just like me and you who is not coughing, but feel a little bit lethargic. But when they go to do X-rays, it was found that they actually had the TB. So the NDOH, the National Department of Health, funded by the Global Fund, has recommended the use thereof of this technology. It is actually a system whereby it is in a container or a truck, being able to reach as many people as possible, and it is going to be used as a screening tool, meaning that anybody can walk into these services and they will be able to go take the X-ray. It has a software which is artificial intelligence, and with that software, the software is able to detect the disease, which will be able to give a diagnosis to say that the person has TB, over and above being able to detect any other thing that might be the person will be presenting with. So that in its own is a way of helping us reach the numbers that we are missing right now, which is around 57% or 46% of people who have TB we don't know about, and that means that the disease is spreading. So importantly, the digital chest X-ray is going to be a game changer when it comes to us and the world being able to find TB early, to be able to put people on treatment early, and to basically find those of a lot of people who does not have symptoms, and that is where it is an important tool for us to use.
Professor, you mentioned, of course, people that are not showing symptoms, who are one of the biggest causes or biggest reasons for why this digital chest X-ray technology is being introduced. But then, of course, there are people who may know or may have those kinds of symptoms, but just don't have, are in the outskirts of the urban areas and the rural areas. So would this technology be then focused on getting to them as well and ensuring that they are treated?
Yes, that is the idea. What the Global Fund has done at this point is to look into what we call high-burdened areas, which is those areas that contribute about 50% of the TB burden in the country right now, and where we are missing a whole lot of TB patients. So those are at this moment in the Eastern Cape, Western Cape, Mpumalanga, and eThekwini. So that is the first in terms of trying to test and find a whole lot of people. However, the reason that it is more of a mobile service is the intention to be able to move towards where the need is. And with this that we have started with right now, it's not only going to be based in facilities. We have actually started putting them in the communities. For instance, in Cape Town, this has been put in Samora Machel, which is a community setting where everybody from an informal settlement can just walk in, not necessarily go to the clinic, and get tested there and be linked to care to start treatment as possible. So as soon as all this evidence has been proven that it is indeed working within our setting, the rural areas will be able to be catered for.
Professor, just before I let you go, we want to obviously ensure that people are not living on edge, because we are a scared nation, we are a scared world now because of COVID-19. So when you hear that tuberculosis is one of the top 3 deadliest diseases in this country, you want to then know and be reassured that this is something that if you do contract, you can still beat, right?
TB is curable, and that's the thing, where we need to be creating more awareness regarding this fact, because TB is a curable disease. Be it is DRTB, which is resistant to first line or drugs that are being taken by everybody else. If you get to have a resistant TB, you still can get second line drugs, and it has shown that it is curable. So it is for us all to be able to access health quickly. And it is for us all to be able to, when you have started treatment, be able to take it until the end. Importantly, it is for us all who knows about TB and the fact that it's curable to share it with everybody that we come into contact with, to share the information, not the TB itself, but share the information that TB is curable, and if you have TB, you can go to treatment. 6 months, you are done with this a simple TB, or 9 months, you are able to be cured.
Professor, thank you so much for your time here on All Angles this morning. That is Professor Deliwe Rene Phetlhu, who is, of course, the TB manager at the TB HIV Care.